Radio Ramadan on 87.7 FM. We're broadcasting live from Evington Road. Good morning, Leicester. It feels like saying good morning, Vietnam, because I know everybody's been out there late last night. Everybody I seem to feel was out in Leicester City, on Evington Road and across the city, visiting friends and family and staying up really, really late, because it was such a great weekend, really, overall, because this is the last weekend, maybe, of Ramadan, and maybe next week, inshallah, we'll be wishing everybody Eid Mubarak on Sunday. But we've got a very, very special show for you this morning. We'll be talking to Damien Rowlands, Dr. Damien Rowlands, who's the head of Children's Accidents Emergencies at Leicester Hospitals, but also in charge, actually, of the whole of the Accident and Emergency Department at Leicester's hospitals and across Leicestershire. So welcome and good morning to you, Dr. Damien Rowlands.
Good morning. Thank you very much for having me. Happy Ramadan to everyone.
Thank you, Damien. Damien, what's your background? How have you ended up in Leicester in charge of the Accidents and Emergency Department? Is it something that you originally envisaged doing, and how have you ended up in Leicester, in the great city of the country?
So when I went to medical school, I was completely under the belief that I would be an orthopedic surgeon, a bone surgeon, and it became very quickly apparent that wasn't really my skill set or strength. And I fell into paediatrics, and I've been really interested in paediatric emergency medicine, mainly because what I really enjoy doing is making visual diagnosis and communicating. And children's emergency medicine and children's urgent care is not about lots of special tests. It's not about being able to do funky surgical procedures. It's being able to listen to people, parents and caregivers, and look at a child and make decisions. And that's what's driven me on.
Yeah, so does that mean that you can look at a child very quickly and assess them quickly to understand how seriously ill they are or not?
Yeah, essentially, it's pattern recognition, and over the 20 plus years I've been doing this, I become a bit. It's a bit like a mechanic. A mechanic who's been dealing with a car can listen to the engine of a car and he knows what's wrong with it. Yep. And I'm essentially doing the same thing with
same thing. And you obviously enjoy your job. I mean, it's your passion by the sounds of things.
Yeah, no, I really love my job, mainly because I can make a difference. And the difficult thing was I can make a difference in a good way in terms of just getting the right diagnosis. What's become more important to me over time is that some families have horrendous experiences, and you may lose your child or my child. And what my job then is to make that day no worse than it possibly could be. And I think that is a task which I really take to heart. It's about taking people through the worst possible time they're going to have in their lives and make sure that you've not made that situation any worse.
I can fully understand that, actually. I have experienced that myself, and I think it makes a huge amount of difference to the family of a child who passes away, and makes a huge difference to the fact that they're able to have a bit of closure, to think that the doctors and everybody did absolutely everything they possibly could, and it makes a huge difference to those people. It's something really personal to me. So we're going to be talking. How have you ended up in Leicester, though? Why Leicester of all places?
Well, it's interesting. So I'll be honest. If someone had asked me, so when did I come here? About 2008. Before that time, you'd end up in Leicester. I'd have gone absolutely no chance. But it was because an academic or a research type job for a junior or aspiring researcher was only offered in Leicester at that time in children's emergency medicine, thanks to Professor Tim Coates and Dr. Fionn Davies, who both still work in Leicester.
Yeah, I know both of them, yes.
And
excellent consultants, both of them.
And I took that opportunity, and that's why I enjoy my clinical practice, but I also enjoy my academic practice, and I'm a professor at the University of Leicester, and there are very few professors of children's emergency medicine in the UK, and I'm really proud of the contribution I've made.
And actually, from what you said earlier, it does make a huge difference, doesn't it? It does make a huge difference because you're actually focused on what matters, not only to the child, but to the parents, and doing the best of your ability, because that making a difference is everything to those families.
Yeah, well, so, and it's one of the things that I'm really interested in is how doctors and nurses and other healthcare professionals make decisions about children and young people. And how we avoid falling into what are commonly known as cognitive biases or little traps. And these are no fault. It's not that people do their job incorrectly or they do their job badly. But when you're busy, you can easily make mistakes. And one of the things I've done over the last decade or so is try and look at solutions to stop healthcare professionals making mistakes.
Because you make assumptions and then you run on with that assumption. But you've sometimes got to stop and just say, let's just cross-check this.
Yes.
Let's just match and just see if it's correct or not. And I think it's really interesting that you're a professor at Leicester University because you're training the next generation of doctors there, which makes a huge difference as well, I'm sure.
Yeah, and it's absolutely vital. I mean, healthcare has had so many ups and downs over the last, especially 5 years, and healthcare is constantly changing. And it's difficult to keep pace, and that's why we need a well-trained generation for the future.
Excellent. You're listening to Radio Ramadan on 87.7 FM. Our telephone number here for the studio is 0116 4822 or you can send us a WhatsApp message on 0774 8855 Damien, so what is the number one issue that children come in with at ED, at Leicester's Accidents and Emergency Department? What is the number one thing that comes in?
So the big concern that caregivers have is fever. Now, seasonally, sometimes there's breathing difficulty during the winter, but generally across the year, it's fever.
Fever, mean high temperatures?
Yeah, and it's interesting you pick me up on that because actually we use language poorly sometimes. And we have this funny thing where we use this word temperature to mean a high temperature, but actually it shouldn't mean that. It's temperature describes how hot something is. And one of the challenges that we've got is that what a temperature is and when it's something bad or something normal, it's really poorly understood. And there's loads of myths out there about it.
So what is the sort of temperature that children need any help with, and what help should they do while they're at home before they seek any medical advice, really? So
most people's body temperature is about 36.8 degrees, and then give or take kind of about 0.5 of a degree. So what we're talking about is around 37 degrees is absolutely fine. Now, before I forget to talk about it, actually, one of the things that people don't get concerned about is really low temperatures. If your baby's temperature is 36 degrees or less, that is not good, and actually that is something you need to look out for.
They need to get advice if it's less than 36.
Yes,
something I didn't know.
No,
I've never heard that before.
Yeah. So but it's really important when you do that. You take the temperature in the right way. So you can go into a shop and you can buy these things which are forehead thermometers or little strips.
Yes.
Please do not do that.
They don't
completely unreliable.
Completely
There's
unreliable.
No evidence.
There's no point doing it then, is there?
Yeah. So it's no better or worse than putting your hand on your child's forehead. And lots of caregivers, especially mothers, do that. Now, actually, mums are really good. And my wife is really interesting. She used to kiss our babies' foreheads, and she'd know exactly if they were normal or not. But what you really need to do is do an underarm thermometer. So if the baby's really little, or what's called a tympanic membrane thermometer, or these are the devices that you put in the ear.
And they're the ones that are worth spending your money on, effectively, aren't they?
Yeah. Yeah, and because that will give you a valid reading. So as I said, so especially if your baby's really cold, that isn't good. That rarely happens, but is worth watching out for. Now, what happens when the temperature gets higher? So if you're about 37.5 to 38 degrees, what we say is that that's a raised temperature, but in terms of really making decisions and making actions, we don't get too worried by that. It's only when the child's temperature is 38 degrees and above that do we call that a fever. And that's why I'm making this difference between, we some say, my baby's got a temperature. Well, I hope you've got a temperature, because if you don't, that's a big problem. It's when a fever. So
a fever is actually technically described after 38 degrees.
Yes, I mean there are lots of people contemplate, but that is the easiest way, to think about it. The key thing to do, though, is that people get really... Have you got a fever or not? Having a fever is completely normal, okay? And it's really important that when we were evolving as a species, our bodies created a defense mechanism against bacteria and other viruses. And what that defense mechanism was is to raise the body's temperature because the bugs don't like it. Yeah. And your body produces chemicals to do that. And it's a forgotten thing. And actually, the tribes in the Amazon realized this hundreds of years ago, and they used to suck on the barks of trees, which gave them aspirin. It's a bit like paracetamol. And they realized that would help. But they also realized that they wanted to relieve the distress of the fever. So the key point to take away is your body creates the fever to fight the virus or the bacteria. It's not the virus or the bacteria causing the fever.
Yeah. It's actually the fight against it. So, and what temperature would you start sort of saying take paracetamol and ibuprofen for children? What is the sort of
so I don't link any temperature at all.
Yeah.
As a pediatrician, also as a parent, I don't want my child to be in distress.
Yeah.
So it doesn't matter if your child is running around the room, laughing, banging things over a hammer, and they have a temperature of 38.4 degrees. They don't need anything.
They don't need it because that's normal.
Because that's normal. Because their body is doing everything it needs for you. For exactly the same time, you could have no temperature at all, but your child be miserable, have a snotty nose, feeling really run down. And actually, if they look miserable, give them some paracetamol or ibuprofen. At least he's not had a fever, but it doesn't matter. What you're doing is you're treating the child's distress.
And actually, if he looks lethargic, if the child, you're going to intervene, and that sort of helps that. Yeah, and so what is your advice as if, because lots of people out there, parents, worry about their children, say it's got a temperature of 40 or they've got a temperature of 40. What should they be doing if it carries on, and at what point? Is it in the first 3 or 4 days, or is it in the first 24 hours? When's best to start seeking medical help?
The first thing I just like to pick up on is the height of the temperature, because it does cause distress. And there's this rumour out there that 40 degrees is worse than 39, that is worse than 38. And actually, if you look at lots of children together, that's not true. We know that if you have a very, very high temperature, your risk of a few diseases is slightly higher. But I'm talking minuscule amounts. Yeah. So the fact that you've got a temperature of 39.5 degrees is really no different than 38.5 or 38. So that's the first thing to say. The other thing is that nearly all disease processes will burn themselves out by 3 or 4 days.
Okay.
And that most children should be able to tolerate, even if the temperature's going up and down and you're needing to if you get to 4 days, I wouldn't do anything before then, because it's very unlikely, one, that the doctor's going to intervene before then anyway. And two is that most of your body's defense systems are geared to kick up over that time frame and will deal with the disease for you.
And during that time, paracetamol and ibuprofen?
Yes, yeah. Okay. And a couple of just key points on paracetamol versus ibuprofen. So I'd always start with paracetamol, and I suggest that because it's just safer. It's not that ibuprofen isn't safe, and I really like ibuprofen. It's a good agent, but it's less discomfort on your child's tummy. Ibuprofen can cause problems there. Always start with paracetamol. Never give them together just for a fever. And this is one of the things that parents and caregivers get really concerned. My child's fever was really high, so I gave them both together. The problem is together they really won't do anything more than having them individually. And then you can't give anything else then for another 4 to 6 hours. So only give one. If it really, after an hour, has had no effect, then you can give the other.
Right, okay. That's interesting. That's another key point to take away from this. You're listening to Radio Ramadan on 87.7 FM. The telephone number for the studio is 0116 4822 the WhatsApp or the message number is 077 488 55055. You're talking about viruses. Lots of these are winter viruses, and they come in the winter. So obviously you're a lot more busier. What happens in those sort of cases? Can anything be done with those viruses that people catch?
So it's just the nature of the winter months. It's not really that it's got colder. It's just you spend more time inside. And if you spend more time inside, you're more likely to pick up things from other people. So we see a couple of viruses spread. One of those, which you may have heard in the news, is called respiratory syncytial virus. It sounds dreadful. It's otherwise known as RSV, but the common term is a condition called bronchiolitis. And bronchiolitis is a very common winter virus that nearly all children get. And that virus makes you a bit snotty, it gives you a bit of a chesty cough, and gives you some breathing difficulty. In about 80% of cases, your child is not going to need any treatment at all. They will never need to come anywhere near hospital or GP, and they will just get better. And the big thing about children with bronchiolitis is if they're little and they're still feeding on milk, sometimes they have difficulty feeding on milk and breathing at the same time. So what they do is they quite rightly prioritize breathing over feeding, and you'll see the amount of milk that they have go down. And that's what causes a problem, causes a lot of concern for caregivers. And my big tip, it's all about the amount of wee they're producing. Now, one of the great things about the British population, and you'll know this as a dad, is that
Nappies.
and I'm sure I've spoken to you about this before,
Yeah.
is when you change a nappy,
Yes.
you weigh it in
Yeah.
your hand. It's this weird instinct that everyone has. You take the nappy off and you give it a bit of a feel. And what we're looking for is a nappy that has some urine in it. It is going to be less because the baby, if they've had less milk, will produce less urine. But if they're having wet nappies, at least a couple of wet nappies a day, that means the milk you're getting to them is going to be enough. And then when the bronchiolitis gets better after 3 or 4 days, they'll go back to feeding normal.
Basically, if their nappy is dry most of the day,
Yeah.
you know that there's something wrong.
And that's the time to start thinking about seeking some advice.
And that's for the winter viruses that crop. And then it's different viruses every year, isn't it?
Well, no, actually, the RSV, or this bronchiolitis
one.
virus, is our big one. And you may have heard in the news, and I'm hoping that there are mums listening to this who have had the RSV vaccine. I mean, this is an amazing innovation just from this year, that we've started vaccinating pregnant mothers so that when their babies are born, they won't get this virus. We've got a lot of work to do. We didn't get as many vaccine out to these mums as we could have done, and we'd really like to push that for next year.
And what was the uptake like?
Well, it was good, and what was really pleasing to see, and this is research that I led on from Leicester with other colleagues around the country, is actually people were saying they just were having difficulty getting access to the vaccine. They weren't scared about the vaccine. We were a bit worried that the word would go out that it's... But actually, all the mothers we spoke to were saying, look, we like the vaccine. We don't want our child to have this winter bug, but we just didn't know where to get it, or it didn't fit into normal schedules.
Where can they get it from?
So your general practice is the best way to go.
Your GP.
If you've been missed out, because there's lots of programs, especially in maternity, to remind mums during their pregnancy to have it. But if you feel you've been missed out, or you missed communications, go back to your GP and say, can I get this vaccine?
And can the midwife organise that? Or is
The midwife can definitely help.
Yeah, that's great. Because GPs are often very, very busy.
Yeah.
And people tend to use midwives or use other sort of
Yeah, that's
hospitals
great advice.
and just try and access the service, because it's very difficult sometimes for lots of people to get through to their GPs. We're talking about bronchiolitis and breathing difficulties. Do you have any other sort of issues that come in from breathing difficulties from young children and young adults, really?
So the big thing is viral wheeze and asthma. And that a large proportion of the population suffer that, both children and adults. We know that there are lots of drivers for having viral wheeze and asthma. One of the biggest ones is having a family member who also has viral wheeze and asthma. But we know that there are some things that we could do to improve that. So not smoking is a really important thing. If smoking, shishas, all things like that, you shouldn't be doing really full stop all around your children, especially, because that can promote viral wheeze and asthma. The second thing is we know that, unfortunately, things like molds and poor air quality. That's also a trigger, and I know public health are working hard on that.
This is an interesting sort of point, really, because 20 years ago, nobody would worry about mold in a room affecting your breathing. Now, everybody's really concerned about it, and it is a major issue.
Yeah. I think we know, unfortunately, especially in Leicester, which has such diversity, but also such inequality. And we can predict the areas in Leicester where families will present to emergency departments more often than not, because they're going to be the areas which unfortunately are the most deprived and are more likely to have accommodations which is probably not suitable or to help children live healthy lives.
And you mentioned shisha, and you mentioned vapes.
Well, vapes I didn't mention, but I should have put that in there.
Vaping. I mean, lots of young people across the city do vape, do shisha. It's very, very popular, unfortunately, in Leicester, just generally, and I think up and down the country as well, and particularly from the Muslim community as well, I've got to be honest. When you can think about a mould in a room over time causing serious lung problems, shisha and vapes in the same sort of category?
Well, yeah, it's difficult to compare directly. What I will say is we probably dropped a little bit of a ball in the healthcare community in terms of vapes. There was this big fanfare that we'd be able to get lots of people off smoking, which is a good thing. But what we've discovered is that kind of vapes contain harmful chemicals themselves, that there's still nicotine, and they've been marketed quite aggressively to be cool. And there's nothing cool about vaping, really. We know that early evidence is suggesting that there is harm, both potentially to the lungs, but we also know the devices themselves have caused harm in and of themselves. And they create I think, a viewpoint that this is a kind of a socially acceptable thing to do. A bit like the adverts, and I don't know if you remember, in the 40s and 50s about cigarettes being cool. And they're anything but, unfortunately.
And shisha?
Yeah, so I mean, I must say, I suppose I'm less culturally competent around this area, if I'm honest. But anything in which you are inhaling chemicals which contain products which are not normally meant to be in your lungs, however you do it, it can't be good in the longer term.
Can't be good in the longer term. And you know, do you see patients come in with some of these problems in the hospitals? Well,
what I definitely know is in my practice, being a kind of a paediatrician who sees children in emergencies, what I definitely see is the impact of some families' behaviours on their children. So you're more likely to find children who have recurrent wheeze and cough if there's a smoker there. And I think families get quite defensive about that. Oh, I only smoke outside. Well, we know that if we take the urine of children who live in families, even if the parents swear blind they're smoking outside, you will find nicotine in their urine.
Really?
Yeah.
Wow.
And so they're exposed to it. It's probably through the clothes. Maybe parents don't always smoke inside. So there is a social responsibility here. And then we also see, and I think that the impact of deprivation is also quite powerful. It's quite stark what we see in our department, that where children come from in various parts of the city.
And for some reason, the social aspect of it has sort of changed, drifted away from cigarettes to shisha and vapes now. And it's almost like by default, vapes came into being because of taking people off smoking. But it's become the more social element now, rather than anything else.
And it'll be interesting to see what plays out. I must admit, big up the next generation of young people, because one of the things that has changed is alcohol.
Yes.
And that has really impressive in terms of the reduction in alcohol consumption, which we see survey after survey. Now, social media has probably had an impact on that. and we may well discuss some of the issues that social media has.
Let's hope social media
Yeah.
plays a positive role in dealing with vapes and everything else.
And it can do, and unfortunately social media also has some negative aspects to it itself.
Yeah.
But I think the point being is that we know society changes over time. We know we've addressed some of the issues with cigarette smoking, not completely. We've been successful with alcohol, so there's no reason why we can't be successful with vaping as well.
And we're talking about social and what's happening and young generation in the last... These are all changes in the last 10 years. What about people on their mobile phones? You know, sitting there, children, young people, sitting on their mobile phones 24/7, it feels like to me.
It's a challenge, and I'm a father of 2 adolescent girls who spend a lot of time on their phones. And why do they do that? For a variety of reasons, but one of the reasons is me. I'm probably a really poor role model. Do I spend time on my phone? Yeah, yes, I do.
We're all guilty of that. That's the problem, isn't it?
And I think that's quite important. And there's a few really good things that the Royal College of Paediatrics and Child Health came up with, and it's not about just removing devices completely. Social media is here, and there is some evidence that it can decrease mental health, but it can in some quarters improve it. The thing is about what your screen time is replacing, and this is the critical thing, is if you're in a family and you're worried, there are some boundaries you need to set. And what you need to make sure is that your child is still getting the activity and direct face-to-face social contact they got. Yes, they can be on their phone, but what that can't do is the phone can't replace dinner time conversation, or it can't replace going outside and kicking a football with your mates. And that's the critical thing. And that's the thing as a parent you can influence.
And that's really crucial, because they've got to have a variety of activities rather than just actually 24/7 at home on their mobile phone, effectively.
Yeah, so we have a few rules. We will always try to have an evening meal with a family around the table. That's definitely phone free and will be conversation. We try, where possible, if we're watching the TV together, that it's not 4 people on their phone listening to the TV.
And we're all guilty. We're all guilty of that, and we're all guilty of going into a restaurant and all sitting on our phones, having a meal.
Yeah,
it's terrible, but we've got to change, haven't we?
Yeah.
And we are guilty of that, including me, unfortunately. Lots of sort of great messages there, really, Damien. But there's lots of sort of children who have special needs, children who are autistic, and they have care pathways, they have care plans to deal with them. What's happening with that at Leicester Hospitals? Is there any improvements or any...
I mean, I think the first point to make, as you make, is that one of these things that's changed over my career is the recognition of neurodiversity and the impact it has on children and young people and their families. We know that we're probably not meeting the demand in healthcare for being able to diagnose these conditions and help families deal with them. So we're much improved, because I think that the recognition of the burden of this is much better. So, for example, in our department, we have a few members of staff who are ambassadors for autism and children with learning disabilities, and they spread those good messages about. And we have play therapists who are expert at dealing with children with learning difficulties.
Are these extra resources that have come in recently over the last few years? Or
well, I think some of this we've been doing for a while. What we're trying to do is recognise the diverse breadths of a children and young person's behaviour. So for children who we know will struggle to be in the busy waiting room environment, we try and accommodate that where possible. I do apologise to some of those parents, especially during the winter months when we literally have no space, but we do where possible recognise that children do need different environments to be that. We will make sure we approach those children with care and kindness, and we have a variety of toys and games and other equipment that can help us especially explain things to children in a non-verbal way sometimes. Yeah. So we have books which guide children through processes. And all of that has blossomed in the last 5 years.
Great. And I know I'm part of quite a few WhatsApp groups helping families autistic or autism. And really, there's lots of people out there who are struggling on a regular basis, because they go to a GP, they struggle with the GPs, So the hospital is sort of becomes a first port of call almost.
Yeah, and I do recognise that, and we also know, especially for children with learning disability, we've still got a lot to learn in healthcare about recognising diseases in that group. If you look at reports of where children have died, there is an excess in children with learning disability that can't be explained by the disease process. And that's probably because these children get missed. They go under the radar. People say, oh, well, it's because it's the child's behaviour rather than the disease. And so there's still a lot more that we can do.
And I know you're always looking at avenues to improve the service. And let's hope you carry on that improvement in that area as well, because I know there's lots of parents out there who are really concerned about their children, and sometimes they don't know what's actually happening, do they? Because the communication always isn't there. The brilliant.
And being able to communicate with caregivers as effectively is critical.
It's critical. It's more about the parents and the carers that you can get all the information from, isn't it?
Yeah. And listening to them. And that's one of the challenges that caregivers do know their children best. One of the problems we do have with that, though, is this concept of being able to listen and reflect back concern so that it comes to agreement. It's the parents' concerns are always valid. I do see sometimes over concern, and there's lots of things where I might disagree with the parent about a treatment course. But what I'm trying to be diligent about is to make sure the caregiver understands my reasoning and that I've listened to all of their concerns. Where we run into problems and where we miss things or parents feel aggrieved is if they've been dismissed. No one's listened to them. It's not as if they're always
wrong.
right, but they're just completely ignored in the consultation progress.
Yeah. And so you would say patience and tolerance, effectively, in some cases.
And I would always caregiver, if you feel that, especially if you've got a child with special or unique needs, is that you ask the healthcare professional, okay, you've told me this, but okay, this is what I don't understand, or how can you help me understand this particular problem? And it might be, and I'm sorry that you might have to repeat that question, but I think it will clarify in that healthcare professional's mind that they've not addressed your concern, and how can they go about doing that?
Excellent. You're listening to Radio Ramadan on 87.7 FM. Our telephone number for the studio is 0116 4822 or you can send us a WhatsApp message on 077 488 55055. Damien, we were talking about GPs earlier. People struggle to get through to their GP. They struggle. What advice would you give to families if they're concerned about their child, maybe not looking well? What is the first port of call, and how do they access the services? Because that's the real crucial element of people's concerns in Leicester.
So a couple of things. I think the first thing to go is do you really need that advice in the first place? And I know that sounds a bit counterintuitive, but as I was saying about kind of a fever and how long it lasts for, I have seen a change in the population where I think 10, 15 years ago, parents would have the capacity to watch their child for at least 3 to 4 days and look after them. We now see families, and I have seen this, where their child has had a fever, and after 12 hours they present to their GP or an emergency department saying, my child's got a fever, what do I do? And that if your child simply has a fever and that's all you're worried about, and this is the other point I didn't make, well, I'm really interested when a caregiver says to me, look, they've got a fever or they've got a cough, but there's something not right about them. That's when I get really interested. Yeah. If you come to me and go, my child's like this, but they've got a fever and I'm really worried about the fever, I'm less worried because the fever and the cough are not going to be a problem. It's when the child themselves has changed when we get worried. So if you're just worried about the fever or breathing difficulty, go to websites. So there's some really good websites. 111 has a website. There's a website called Healthier Together. There's a whole range of videos. I mean, in fact, if your children watch Operation Ouch, which is with the Van Tulliken brothers, I've done videos with them which teach families and things about fever, breathing difficulties, and all these are on the Healthier Together website, which has links to Leicestershire Partnership Trust and other providers as well. So that's the first thing. Do you need that help? If you do decide, because the symptoms or signs your child's had, it is worth phoning 111. Now, I know sometimes feel that there is a long wait, but actually that 111 service is highly effective at giving you the advice you need. And if you do need an appointment, they will find you one and book you into something without you having to wait in the emergency department or kind of phone up your GP the next morning.
And pharmacies, because lots pharmacy first, lots of advice to go to your pharmacist. Is that worth doing for parents?
So I think pharmacists have got a bit of a raw deal. Pharmacist training is very equivalent to a doctor's in the initial years. And they have been trained up to deal with a huge range of self-limiting and minor illnesses and can provide you with bespoke advice. Nearly all the pharmacists have consultation rooms now, so you can go away. It's not as if you're talking about these issues. You get a private room to go with a very experienced healthcare professional who 9 times out of 10 will be able to give you the treatment or the advice that you need.
So pharmacy first, 111, GP, A&E is there, but at the end of the list.
Yeah. So A&E shouldn't be a place where you've gone to if you've not had other previous advice or those advice isn't working.
And how busy is the A&E department? Because I know I've seen the figures when I've gone in and I've looked around the A&E department, both adults and children's. It's always extremely busy, isn't it?
It is, and then the nature of the beast is that we're seeing about a 5 to 7% increase in attendances each year. When I first came to Leicester, our Children's Emergency Department was seeing about 38,000 children a year. We now see 70,000.
Wow.
So we've essentially doubled. And I can tell you the population of Leicester hasn't doubled in the time period that I've been
there.
Yeah.
Yeah. I mean, when you think about how many consultants and staff are there, there's probably almost doubled in the time that you've been there.
Yeah. Maybe even a bit more so. And we feel we provide a high quality service, and that we have a number of extremely trained members of staff. But that volume of increase each year isn't a great experience for families who sometimes do need to wait a long time for care, and we do the best that we can to mitigate against that. But one of the best things that you can do as a caregiver is try and seek out that advice even before your child is ill. So I would just say, kind of one of the big things I advise is it's much better actually now, maybe this afternoon, go on a website, have a look at where those information sources are, so when your child becomes ill, you know where to go, and you're not having to do that in a panic.
Yeah. Another bit of advice that somebody gave me, and I did some investigation on this, and I just wanted your take on it. Medications and medicines that children or adults need. There's lots of price differential, and we're living in a city that has quite a large number of child poverty, almost 40% across the city. Parents and people need to be a bit more savvy about where they buy their medication, because it's all very similar. It's just the brand names are there, aren't they?
Well, I mean, I almost have difficulty saying it. But you'll have heard me be very careful about the use of the term paracetamol. I will only ever say paracetamol. You will not hear me say Calpol.
Yeah.
And it pains me, because Calpol is a product which is purely marketed. There is nothing in that product that is any better than any own brand. Yeah. And you are paying a premium just to fund a pharmaceutical company's advertising product.
And the difference is stark. I have some regular medication, and for 30 tablets of hay fever tablets, the difference is if you go to one of the major retailers, chemist type retailers, it would be £5 or £6. But the same medication in just that actual non-branded formula, which means it's the same medication, is £1.
Yeah,
a huge difference.
It's a huge difference, and there really isn't anything different about these products.
Can I ask you, in your medicine cupboard, what do you have in there? Because people should be buying it in advance and just storing it away and forgetting about it. So when they need it, they've got it available. So what do you have in there?
Yeah, so I've got two girls. So we've always had some paracetamol and ibuprofen.
Yep.
And we've always had some antihistamine.
Which is?
So there's the brand name that people have heard about will be Piriton.
Yeah.
But again, Piriton's another good example, a bit like Calpol, of the actual product is called chlorphenamine.
Yes.
And that is available again at a hugely reduced price, and it's a good medication.
And what do they use that for? The antihistamine. What is that antihistamine?
So that's for kind of mild allergy, and so useful, often very useful if your child has chickenpox, because they become very itchy and irritated, or if you've been stung. And especially if you're a child who's struggling with dealing with that sting and other agents haven't worked. It's also some kind of families know they need that product anyway because of mild allergies their family has.
And do you have anything else in your medicine cupboard?
So I personally don't. There's nothing else that.
So they're the three main things that you would advise most people to actually keep at home, wouldn't you?
Yeah.
Yeah, generally by and large. And maybe purchase them in advance so that you've got them at home and they're in your cupboard. Because in an emergency or a time, it's not always easy to find a shop that you can get them from.
I think the key thing is, I think there are some medication. If you've got children, you're going to burn through the medication. You have to be quite careful about the amount of medication you just keep that might go off. But I think especially for children, those medications are, I suppose, are so regularly used, they're worth having.
Right, we've got a message coming in. I'm going to read it all out because I like a challenge, and that's what it's about. Salam, informative conversation. In my opinion, I feel there is conflicting evidence regarding the topic. Your messages are to self-manage at home for 4 days before seeking help. However, quite often media messages go out saying it's always to seek advice if you're worried about your child. Let's answer that one first, Damien.
So I've read the second one. So I actually, I have a great deal of sympathy for this viewer. Although the second one I will explain. This first point about seeking advice. Yeah, I really agree with you there. And I've had discussions actually with the Royal College of Paediatrics and Child Health about this. Yeah. Is that we can't have it both ways. No. And one of the challenges is, especially kind of post-COVID, was trying to reassure the public that healthcare services were open and were available. And then when we flipped back into when they've been kind of overwhelmed again, we've tried to reverse that message. And I think it's a fair cop to say that we've not got that balance right. That on one hand, that you've got me sitting here saying, look, please stay at home, and then you've sometimes got messages clearly about sepsis which are saying completely the opposite. I think the key message to me is a lot of stuff that you can manage at home.
The second part of the question, secondly, quite often NHS 111 will advise you to go immediately to A&E based on a phone advice, therefore making the parent feel the situation is urgent. But you get to A&E and there's often an enormously long wait and zero urgency, and at times indifference and lack of empathy from staff. Lastly, the lack of GP appointment makes A&E the only choice if you're a parent and really worried. Pharmacy first is helpful but has its limits.
Yeah, so I have sympathy with the GP appointments. I think pharmacy first continues to improve as time goes on. I will say, though, if you are phoning 111 about a child who has a fever, and maybe you're worried that fever's gone on for 2 days, the person over the phone also has to be able to respond to your level of concern. And I think one of the challenges is that if you go big on how concerned you are, they want to address your concern. So they will try and deliver that by sending you to the emergency department.
it's great to have you on our show, Damien, and I really appreciate you coming in. I know you wanted to mention hand hygiene and making sure you clean your hands and make sure you carry on with general hygiene. That's a great message. Can I take the opportunity to thank you and thank all the staff that work in your department across the hospitals for the excellent patient care they deliver on a daily basis, 24/7, every day of the year, and they do it with a smile and a fantastic, go over and beyond what they need to be doing. So thank you for doing that. You're listening to Radio Ramadan on 87.7 FM, and you're listening to the Health and Wellbeing Show. Inshallah, we might be back next week. We're not sure whether it's going to be Eid, but Eid Mubarak in advance.